4 News.
Welcome back. If you find yourself in need of knee replacement surgery, you may have a robot assisting the surgeon. Joining us here is Dr. Jeffrey Jackson from St. Mark's Hospital. So tell us about some of the advancements we've seen in robotic surgery.
Yeah, so robotic surgery is very exciting for knee replacement. A lot of people will ask us, why have my knee replacement with a robot? And I think it really comes down to the precision that we can get with using the robot. So the robot will allow us to get our sizing pretty close to perfect every time. The second way that it helps is in balancing the knee replacement itself. So the art of doing a good knee replacement really comes in getting a knee that's equally tight or equally balanced in flexion and throughout the arc of motion. And the robot helps us in balancing that so that we can put the replacement in a particular way that will make sure that the knee gets well balanced. In addition to that, the knee replacement with a robot is safer. It helps us so that we don't cut things that we're not supposed to cut, and it helps in patient recovery as well.
Share with some of us non-medical lay people exactly how this works. How is the robot used for this surgery?
Yeah, so a lot of people think, and I've had patients in clinic that have come in and we've talked about the robot, and they get a little reticent because they think, no, I'd rather have you do the surgery than have the robot do it. And in reality, I am still doing the surgery, and other doctors that use the robot are still doing the surgery themselves. The robot really is an instrument, so it's a way that we can be a little bit more precise in our cuts. It does control and helps us so that we are safer when we do it, but in reality, the surgeon is still doing the surgery.
That's good to know. Well, I know a lot of people are watching this thinking, well, my knees tend to bother me, or am I a candidate for knee replacement? Who should be getting their knees replaced? Yeah,
good question. So people are candidates for knee replacement when they satisfy a few criteria. First, they have to have painful arthritis in the knee. Second, they have to have failed conservative measures. So when you come in to see us, we'll initially start with conservative things like anti-inflammatories, exercise, physical therapy, cortisone injections, and those types of things first. And if you still have pain after we try those measures, then you're a good candidate for a knee replacement.
So where can people go to get more information on this?
You can always find us at saltlakeorthopedics.com.
And we'll put that information up on our website as well, abc4.com. Dr. Jeffrey Jackson, thank you so much for coming in and providing this education for us today. We certainly appreciate it.
Yeah, thank you.